My name is Maya Tolstoy, and I am the Maggie Walker Dean of the College of the Environment at the University of Washington. Thank you so much for coming tonight. At the University of Washington, we acknowledge the Coast Salish peoples of this land, the land which touches the shared waters of all the tribes and bands within the Suquamish, Tulalip, and Muckleshoot nations. Tonight, we're here to hear from our distinguished guest, Nooshin Razani, who Maggie will introduce more formally shortly. Before she does, I would like to talk a little bit about the Doug Walker Lecture Series, now in its 7th year at the College of the Environment, as well as a few comments about Maggie Walker as well. The purpose of this event is to celebrate the good work of Doug Walker, that Doug Walker helped to spotlight, including what it means to fully embrace our natural world. Doug was a remarkable person who cared deeply about the human connection to nature. I was not fortunate enough to meet him, but I understand he had a real zest for life, and he believed in making the outdoors accessible to all, no matter one's background or circumstances. Tonight, we honor that enthusiasm and dedication. The other driving force that has made this series come to life is Maggie herself. And I'd like to take a moment to acknowledge Maggie and the tremendous impact that she has had on the College of the Environment, as well as the University of Washington more broadly. As I was making my transition here from Columbia to become Dean at UW about 3 years ago, one of the first names I heard was Maggie Walker, and not just because my deanship was the Maggie Walker Deanship. And I soon learned why. Maggie is a graduate of the University of Washington, a fierce advocate for the university, and we are fortunate to have her as a champion for the College of the Environment. She is a conservationist and a philanthropist who works tirelessly in the community on issues she cares deeply about. I am also personally grateful to Maggie for being so generous with her time and insight as I navigated my own transition here to Seattle. Maggie is just, as those of you who know her, is just such a powerhouse and so full of wisdom and ideas and insight and energy and enthusiasm about the environment in particular. And one of my great pleasures in meeting her, even in my interview, was seeing that we shared this passion and really bold ambitions for the college. Maggie currently serves also at the helm of the Walker Family Foundation. She is the founding board chair of Friends of the Seattle Waterfront, and if you haven't been down there recently, you absolutely should. It's spectacular. And the retired chair of the National Audubon Society. She's worked closely with the College of the Environment over the past decade, chairing the advisory board and representing the college as a member of the UW Foundation Board. Her philanthropic support includes the Maggie Walker Deanship, the one I currently hold, the Doug Walker Endowed Professorship, and the establishment of this lecture. Maggie is also now a University of Washington Regent. Her contributions have left an indelible mark on the University of Washington and the communities far beyond our walls. Thank you, Maggie. Note on format before Maggie comes up. The keynote lecture will be roughly 40 minutes, followed by a 10 to 15 minute Q&A. We'll have 2 microphones available for the audience to use during the Q&A. The microphone is on a stand at the front. Simply come up and ask your question. For those of you who may have difficulty getting to the mic, please just raise your hand and a staff member will bring the second microphone to you. And please hold your questions until the Q&A begins. The event is being recorded and will be posted soon at the College of the Environment website. And now please join me in welcoming Maggie Walker to the stage.
So you might say that I paid Maya to make that incredible introduction. Thank you, Maya. That was lovely. So, welcome everybody. There's a lot of light in our eyes up here, so it's hard for me to see everybody, but it does feel like I probably know most of you, and I just want to welcome you tonight. You know, it's been almost 8 years since Doug passed away in a climbing accident, and it's kind of hard to believe. I know a lot of you knew him, but his spirit lives on here in this lecture, because he cared, as you all know, because many of you were probably dragged out into the wilderness with Doug. You know how much he cared about it and how he came alive. And tonight we're going to hear from someone who's been studying this and has, you know, helped to create this whole, what is the word, field of understanding our relationship as human beings to what we call the natural world. You know, frankly, it's our world, it's what spawned us, and we belong in it, but we've lost touch with it. Part of what we're most interested in, and this field which the university is engaged in, the college is engaged, is understanding just how important the relationship is between humans and nature and what we need to do to maintain its incredible beneficial effects on us just as human beings, as a species, as opposed to all the other benefits that it brings us. So I'm delighted this evening to bring you Dr. Nooshin Razani. She's a pediatrician, a researcher, and a passionate advocate for the healing power of nature. She's a founder and director of the Center for Nature and Health, based at the University of California, San Francisco, the Benioff Children's Hospital in Oakland. The center conducts original research related to nature and health, and helps healthcare practitioners incorporate nature into their practice. It is now possible to get a prescription for nature. Isn't that amazing? Think about that. Provides clinical care informed by the key role that nature can play in healing. Dr. Razani is an attending physician at UCSF, Benioff Oakland's ambulatory department, and assistant clinical scientist at Children's Hospital. She attended medical school at UCSF, completed a pediatric residency at Benioff Children's Hospital, and has a master's in public health from the Harvard School of Public Health. She has conducted many primary research projects on the clinical applications of nature, and I think you're going to hear from her as she gives a presentation about nature and health across the U.S. and has published many peer-reviewed articles on the topic. So I know you look forward and will join me in welcoming Dr. Razani. Thank you.
Hello, everyone. Thank you so much for having me, and thank you for the kind introduction. As you heard, my name is Nooshin, and I'm an associate professor in pediatrics and epidemiology and biostatistics. I come to you from UCSF at the Center for Nature and Health, where our work is at the intersection of basic science, clinical medicine, and public health. And that's the lens that I'm going to be bringing to the discussion tonight. I will talk about personal wellness, but that will be within a frame of public health. I'll start by talking about a framework that has helped me make sense of all the literature coming out on nature and health. I will follow that by talking about the progress that all of us together have really been making in creating the argument that nature is a public health priority. And then I will talk about a vision moving forward and how to integrate nature into national public health initiatives for wellness. And a few disclaimers. One is that I'm a pediatrician, and I like children more than adults. So a lot of my work will be about pediatrics. And the second is that I believe that I know a lot of you in this room, I think, and you have been leaders in this field, and so some of what I share is lessons learned and thoughts for us in how we can move forward together in establishing this field. So First, I'm going to talk about a unifying framework that has really helped me argue for nature to be part of public health initiatives and budgets. And the framework that I've been using is that of resilience. And when I started doing this work in 2009, the first study out there was the one where Ulrich put patients after surgery into either a room with a view of a brick wall or a view of nature, and looked at recovery time and use of medication for pain, and also negative comments from the nurses about the patients, and showed that the patients that were in the room with a view did better than the other room. That was really the first study, and since that time, it's become a beautiful and vibrant ecosystem of work coming out on this topic. And really, we have evidence from prenatal to elderly, every stage of life, showing that nature helps health, and showing that you live longer if you live near and around nature. But that's too much to explain. And so I have really been impressed by the work showing that nature promotes basically homeostasis, which means that when you're in and around nature, you tend to rebound better and go back to whatever your baseline was. There are primarily two competing theories around this idea of why nature promotes homeostasis. And as I'm sure many of you know, one of them is called attention restoration, and it talks about the central nervous system. And we have now, from surveys to actual fMRI and imaging studies to EEG work, showing that cognitive recovery, mental fatigue, emotional regulation, these are all improved in natural settings. The other theory is called the stress recovery theory. And as opposed to the work on the central nervous system, this looks at the peripheral body, the heart and the vasculature and the rest of your body outside of your brain. And there is a consistent body of work showing that when people are in nature, they have less severe reactions to stress, whether that's measured by cortisol or heart rate variability, or just how you feel on a survey. It also, people have shown that damage from past stress is ameliorated. You are prepared better for new stress. And there's actually amazing work coming out now on multi-generational stress, which is measured by telomere length, showing that being in and around nature tends to improve all these things. And the theory here is that, as you heard, we developed in nature, we are nature, and so probably our ability to get back to baseline developed in nature as well. I would like to guide you all towards a study by David Strayer's group at Scott et al. That came out in the Park Stewardship Forum a few years ago. And what they did is they put together attention restoration and stress recovery theory to basically describe that the brain and the body are connected, and that your peripheral stress is mediated by the parasympathetic and the sympathetic response, and that your brain can control that. And so your brain is involved in whether you are pushed towards a sympathetic response, whether your heart rate increases, or whether you're able to maintain a parasympathetic response in the face of stress. And they talk a lot about how the vagus nerve is involved in this relationship. And there's actually a bunch of research now coming out measuring vagus nerve activity when people are in nature, and making the argument that being in nature helps both, and that they're related. And from a public health perspective, this is huge, because that vagus nerve activity is basically what we train ourselves to have when we are becoming mindful. And this is basically what we do when we work on meditation or try to figure out how to modulate our own response to stress. And if there is a way to not have to go through that training, basically, and on a public health level, make it so that everyone is more mindful, that can have very big public health implications. So in addition to that, individual evidence on why each one of us has more resilience in natural settings, there is also so much work showing that being in natural settings also helps you have other health behaviors that improve resilience. It helps with social connections, physical activity, just being aware of your senses, sleep, and many other things that I didn't put here. And this is a figure that we developed with the state of California, describing how being in nature can help you connect to yourself and to others and to the planet, and can help tip you towards healing from toxic stress. Toxic stress is a very important concept when it comes to child development. And one of the things that you will immediately find when you read the nature and health research is just like how at every stage of life there's some benefit. And I think that resiliency might describe some of that. If you note, I put the impact on child and human development because child development is human development, and whatever happens to children has a very large impact on adults. So the public health impacts of toxic stress in childhood are very big and have a large body of evidence describing them. A toxic stress is basically a trauma that is so big that it overwhelms a person's ability to cope with that trauma. These can be things that are often ongoing or daily, and there were 10 initial traumas that were described in childhood that have a very big impact, and we call those the adverse childhood experiences. And they're things like physical abuse, sexual abuse, severe neglect, violence against a mother, divorce, but don't freak out about that one, or any of them actually, parental substance abuse, mental illness, incarceration. And there are many complaints about the 10 that were studied, and there is a cultural bend to them. But in general, what they are measuring is family disruption, or a child who has been separated from mechanisms for support from their family, and also chronic stressors. And what they find is that when there are those ongoing chronic stressors, the stress hormones, and cortisol is just one of them, actually over time start working like toxins on the body. And they have an impact on your vasculature and your brain that have long-term consequences. And if you see on the side, if you have childhood experiences in childhood, it can lead to disrupted neurodevelopment, social, emotional, cognitive impairment, adoption of high-risk health behaviors, and then in adulthood we see things like heart disease, obesity, and early death. Okay. And so ACEs are very, very common. Everybody has usually about one. Well, 64% of people, but I don't know who the others are. But and about 1 out of 6 adults have more than 4 ACEs, and having more than 4 ACEs is a marker for lots of health problems later in life. Somebody just last year in JAMA published an article looking at the cost of childhood adversity, estimating that it results in $14.1 trillion of cost a year. But the important thing for us is not that we need to stop all adversity, but we need to increase the ability to cope with stressors. And in general, safe, stable, and nurturing relationships and environments prevent and heal ACEs, which to me is a very, very silver lining and a great place for the nature and health world to focus our work. So I bring up all of this stuff about resilience and ACEs, not because every researcher, everyone interested in nature and health has to adopt this model, but just to give you an example of how having that framework has really helped our group advance nature and health. It allows us to talk about the effects of nature in terms of human health priorities. And it also helps us talk about nature and health in a way that is very understandable by public health people and public health programs. And as an example, this wheel that you see here is what the state of California used. Over the last 3 years, there was a $65 million initiative for ACEs in California, and we got them to put nature in there. And nature was one of the 7 stress busters. And I think adopting frameworks that may come from public health, but nature can fit into them, facilitate the goal of creating scalable and fundable solutions, hopefully aligned with national public health models. I can't remember, I know I gave the caveat that I'm a pediatrician, but I also need to give the caveat that I am very pro-nature. That's just like a value system that runs through all of this work, and I definitely have the goal of an Earth that lasts a very long time for many generations, and I think that many healthcare providers do. And so these are ideas for how to protect nature as well as improve human health. So I'm going to step back for one moment, and getting to that framework and working with the state took a really long time. I want to talk a little bit about the path of how at UCSF we got to that place. And we did start with PARC prescriptions and then moved into trauma-informed nature access everywhere. And I think the story of how we did it talks a little bit about this field and progress in general in making nature a public health priority. So I was a pediatrician, and I was already very interested in nature and health, and I was working on developing linkages between parks and clinics. And we did start nature prescriptions at our clinic. But I'll give you examples of the types of patients that we would see. For example, an 8-year-old with asthma, obesity, and anxiety, and ADHD. That's someone that would be a candidate for a nature prescription. A 4-year-old who had lost 20 family members the night before the visit in Yemen. That was another person that received a PARC prescription. Children with autism living in homeless shelters where the family was very worried about being kicked out because of how loud the child was. So I'm not saying that any person's pain is more than another person's pain, but just describing that for the patients that we saw and still see, there are multiple barriers in getting out into nature. And it became very clear that a piece of paper from us was neither the solution nor the reason why the children were not in nature already. Another thing that was happening at that time is there was a lot of pressure on clinicians to talk to patients about obesity. But really the patients wanted to talk about stress. And I put this up here because I believe that this is the institution where this paper came from. And I want to thank everyone that worked on it. Because this was really one of the only frameworks that was available at that time. And this was so helpful. I had it like tattooed on. I had it laminated and I would show it to the hospital administrators. It was just, took this potentially like frou-frou thing of nature and put arrows and p-values on it. And the thing that was so helpful, I think, was that it was evidence-based, because that is really important. And what it showed is that physical activities on the list of things, but it's not the only thing that nature improves. And further, at that time, and it may have changed now, but obesity didn't always change when people were in nature. It wasn't the main outcome to work on. But stress was always in every paper. And it was a consistent finding. And so this is the work that we use to develop our own evaluation of our PARC prescription program. And so, can someone tell me what time we started? Because I forgot. Okay, thank you. So after doing our PARC prescription program for a while, we did a randomized trial, and we looked at facilitated PARC prescriptions, where once a person got a prescription, we actually took them out into nature, and that was through our SHINE program, Stay Healthy in Nature Every Day, where we worked with East Bay Regional Parks to have a bus and take people outside for a fun outing, which was very scientific. I'm just kidding, we just played in nature. Versus just a pediatrician talking to the patient about nature and giving them a map and encouraging them to be outside at least 3 times a week. And then in the study, we enrolled 78 dyads, a parent and a child, and we followed them before, after, and 3 months later. And what we found is, first of all, there was no significant difference between the 2 groups in stress in parents, which is kind of a negative finding, but there was a lot that we learned. First of all, one of the reasons why there was no difference between the 2 groups is because everyone's stress got better. And so overall, the stress in parents decreased. And the thing that was really interesting is that, and we did not expect, is that the group that only had the discussion with the pediatrician, the independent group, actually ended up going to parks more on their own than the group that we took out once a week. And the other very interesting finding is that every park visit with your family, whether you did it with us or on your own with your family, resulted in a small but incremental decrease in parental stress. And it also resulted in a small but incremental increase in pediatric resilience. And that pediatric resilience improved, and that improvement was mediated by a decrease in stress in the children. But I put pictures of our outings on the bottom because they were still super special, and we really cared about them, and so we realized that maybe we were being a little patronizing, thinking that families needed or had to come with us, but we wanted to understand a little bit about why the other group did better, and also just what was associated with compliance with the PARC prescription. And what we learned is that a baseline nature affinity, like believing that you loved nature at the beginning of when you got your PARC prescription, knowledge of where to go, not your income, but how much money you think you have to spend going to parks, and how much time you have available to go, your perceived time to go to parks was associated with whether or not you followed through on the PARC prescription. But your income, race, gender, or which group you were in was not associated with compliance. We also looked at, separately, at how park access was prioritized among low-income families. And amongst 900 people, about 17% reported that they didn't have access to a park at all, and that was an unmet need. But out of those, only 22% said that that was one of their top 3 unmet needs. And priorities like food insecurity were almost always ranked higher than not having access to a park. And so, I'm going to skip the next one, but this is the type of work that we really realized that park prescriptions are very useful and very important, but there are some gaps in equity when we're doing this work. And that sometimes those who are of highest need may not access nature or may not perceive that they have access to nature, and that a park prescription from a doctor is not enough. Around that time, we worked into figuring out how to get out of clinics and to really think about how to improve nature access everywhere. And this is when we started doing a formative assessment for the ACEs Aware initiative that I mentioned. And our goal with this assessment was to really explore how nature-based interventions could integrate into the California ACEs Aware network of care. And I mentioned that California had this big initiative, and what they were doing was training all Medi-Cal providers. At latest count was like 50,000 that had been trained to screen for ACEs, and then if a child had ACEs, they would refer them to programs to heal or treat or prevent future ACEs. And so we were making the argument that nature should be one of those referrals. And in order to figure out how to operationalize that, we spoke to families. This is something that I call an outdoor provider, which is, I think for many healthcare providers, we think of nature as just a place, but after being in this field for a while, I realized it is a place sometimes, but it's also a whole set of people and organizations that help mediate that relationship. And I call those people nature or outdoor providers, but I'm open to feedback if there should be a different name. And then healthcare providers. And we tried to reach most of California in our interviews. And so first I'll present some of the findings from the families that we spoke to. We did a narrative analysis of the interviews. And what we learned from the families is that healing in nature is not a place or a trip, but it's really a set of daily experiences and relationships. And from the narrative analysis, the types of connections or relationship type concepts that people talked about had to do with sensory engagement, things that they did daily, like checking in with an animal or watering a plant. A lot of stories about family connection, peer connection, community connection, and connection to ancestors. A lot of the stories about nature were about memories that happened on private property. And I do think that's something that we need to think about, because a lot of our work is about parks. But some families actually made it clear that being in your own place led to automatically safety and freedom and privacy, which were highly valued. Here are a few of the quotes. When we garden together, it's not just about plants. It's about growing our community, sharing our stories, and helping each other. It feels like we are planting hope alongside the vegetables. That was an African-American mother. It doesn't matter how small my home is. What matters is the nature outside my door. I plan to be with whatever is available just outside my door, like the tree in the street. It's so helpful for me to see the trees, talk to them, and hug them. It's like when some people go to a movie or busy restaurant. There's a tree on my street that I see and talk to. It brings me the same joy that I felt when I was with my father. It's essential for human beings and animal life to connect with nature. Without it, we feel suffocated. That was a Middle Eastern grandfather. The hummingbirds that visit my small garden on the balcony, the chuparosas, are part of our family lore, symbols of hope and prayer in our Catholic tradition, a Latinx mother. So here are some findings from the outdoor providers. First of all, they perceive that they are already very much on the forefront of trauma care. And our survey happened to happen right after COVID, and so many were really talking about the heightened need for trauma care and that they were the front lines during COVID. In terms of whether or not their agencies had an awareness of this concept of being trauma-informed, about 55, half said that they used trauma-informed strategies, but that it was inconsistent. About 65% felt that they were familiar with ACEs, but some really said they did not know what those were. There was a lot of interest in working with healthcare providers, but there was an acknowledgement that there's a gap in readiness for referrals, like even being able to respond to inquiries or do any sort of personal follow-up with the provider, and a real need for institutional support. And really that need for support was not even thinking about the providers, but just really in dealing with trauma in outdoor spaces. And whether that was from training on how to deal with an acute trauma, behavioral incident, or even having the opportunity to have long-term relationships with people that come outdoors, which not every agency has. There were a subgroup of people that are amazing, and I wish it wasn't a study because I would tell you their names, but they are people that are already doing trauma work outdoors. And they really spoke about the importance of a therapeutic alliance and thought that this work was actually highly specialized work. And I think it's because they work with very highly traumatized youth. But they talked about the fact that this is a complex thing to do, and especially for children with higher ACE scores. And it takes a lot of planning to allow the children to feel free, and a lot of not being committed to whatever structure you had already arranged. I learned a very important phrase, which is adventure by choice. And they talked about the need for specialized staff training. Staff must be authentic, willing to be vulnerable, and open to trust building through trauma-informed approaches that include de-escalation of confrontational situations and reassurance in moments of withdrawal. There is the potential for trauma-informed care to become a checkbox item, something organizations claim after minimal training. However, the scale and intensity of what we see can vary greatly. I don't use the word nature because we are nature. I connect with our non-human kin. Individual wellness is a myth. I work on community wellness. These are some of the quotes from the outdoor trauma healers. In terms of healthcare providers, there was also very strong interest in having nature as part of what they refer patients with ACEs for, but there were real gaps in knowledge. About half thought that they knew the science, and 80% said that they understood the barriers, but when you get deeper, that didn't always hold true. So about 70% felt uncomfortable bringing up the issue of race and nature. About half were unsure of how to even find an outdoor agency to partner with. And in the narrative analysis, it was interesting that nature was seen kind of as an inner backdrop to healing. The discussion did not have the same words about connection that we saw in the family interviews. Most commonly cited needs were just any up-to-date referral list of outdoor agencies. So this list is things that were cited, and then the ones with the little medals are the top 3. So one was just who do we refer to, the other was more understanding on the science of this field, and then training and technical assistance to implement nature referrals. So I think our takeaway and our recommendation to the state was that the issue of connection matters, and it did fall through in each of these buckets. And I know that there's more than these 3 stakeholders. There's schools and many other potential stakeholders, but for these 3, I think that investing in the human component, the relationships that could be built, would be very high yield. I think in terms of the issue of families wanting to be in their own homes and experience nature, it's kind of the lesson that I learned when our outings were not as important as families going to nature on their own, is it feels like a loss, but it's actually not a loss. first of all, it's a lot less expensive than having to take people into nature. And also, at the end of the day, public health has to work for people, and if people want to be in control of their nature experience, I think that's a huge public health win. But there are opportunities for improved alignment amongst all of us professionals to help facilitate whatever that nature experience ends up being. So the last point on this journey that we've been on at the Center for Nature and Health, after doing our PARC prescription and then the formative assessment, we are now doing another kind of PARC prescription trial, but this time it's referring specifically children who have anxiety after ACEs to a nature prescription program. And again, we have a group where we take out to nature. And I want you to notice that when we say nature, it's actually a bundle effect, and we're not really stressing out about like exactly how much nature. We're saying that it's all of these things that are going to happen on the outings, and that's okay. It's just a whole big package. And then the second arm is only going to have a journal so that families can go on their own. And then this time we are going to have a third arm that does nothing at all, so that we can really evaluate whether these two work. So if someone can tell me how much time I have left.
Probably not that time.
Okay. Then so those were a framework and also our experience at UCSF. And to finish, I will just say that nature-based work definitely aligns with national health, public health priorities. Being in nature helps prevent chronic illness, and it can do so cheaply. It helps with behavioral health, and suicide prevention is a huge Biden initiative that happened with lots of national investment, definitely not enough, but going into it. I think that nature can help with pandemic preparedness, and we can talk about that in Q&A if anyone's interested. And it can definitely help people act in equity, health equity, and accessing medical care. So I won't talk about this. But I do, except to say that we are doing a systematic review of all the studies that are out there to see whether people have really thought about this issue of scalability and public health impact. I do want to give us, I know that a lot of times we say, oh, every study is different, it's heterogeneous. I think this field has done an unbelievably amazing job. And the fact that there were 6,000 titles out there and we have 44 trials to look at for scalability in the matter of 10 years, I feel very proud to have been part of this movement. And for everyone out here that is working in nature and health or an academic, I think we can all help each other by using evaluation mechanisms that have high yield outcomes that matter to public health. And I just threw a few of them up here before I end. So that's it. I'm from the Center of Nature and Health.
I get the first question.
Yes.
So maybe I wasn't listening, but what I'm curious about is, okay, therapeutics, you go to your session, you go into nature. How do you integrate that back into your daily life where the trauma is? So how effective is this process, and where is the, are these people being isolated from their traumas, or are they going to nature, improving, and then going back to their traumas?
Thank you. That's thank you for asking that. Actually, one of the things in our systematic review that we asked is whether there was any skill building done during the nature outing. Because when you look at other trauma interventions, It's rare for a trauma intervention to just be about the time that you're with the intervention. There's almost always some skill building for you afterwards. And we're not finished with our analysis, but one of our hypotheses is that the nature-based programs that have some skill building, because many of them do, whether it's outdoors, leadership, or adventure, there's often some skill building component that may not explicitly be about trauma, like about cognitive behavioral therapy, or may not be exactly what we do in medicine, but it can be easily translated. So one of our hypotheses is that those will be more effective. So that's in terms of treating a person that actually has illness or some dis-ease or imbalance. Because toxic stress and ACEs are risk factors. Not everybody that has them actually goes on to develop clinical anxiety or something that needs treatment. So I say that because the other application for nature is, in general, to improve the baseline wellness. So I did not talk through an analysis we did of a national survey that showed that children who have no park access tend to have worse health outcomes. But the improvement that came from nature wasn't like, it's not a double risk or a triple, it's like a small, tiny improvement. Like from an odds of 1 to 1.2 or 1.3. So it's something that you might not see in each person, but for a public health department that's in charge of millions of people, that little 0.1 or 0.2 can have a big difference. It's like the thing that I said, that if we just get a shortcut to mindfulness for everyone, that can have a public health impact. So I guess I don't know completely the answer to your question, but I think it's a combination of, if we create environments that are pro-health, then I think fewer people hopefully will dip into the need for really specialized trauma care. But in that group that really needs it, I think your point is very important, that it will probably take programs that are intentional about healing trauma in a way where they build skills. The other big thing about, not every nature program, but many of them are based on a one-time experience. Where we did a review of non-pharmaceutical programs for childhood anxiety, and really the minimum effective program that we saw was 6 weeks long with 3 times a week meetings. So, yeah.
At least.
At least, right? Yeah. Was that? Yes.
Hi, thank you so much.
Thank you.
My name is Christy. I teach at UW, and I serve probably about 600 learners a year, mostly 18 to 22, a lot of anxiety. So I'm trying to figure out how I can translate some of what you shared to share with my students. So I guess what counts as nature and how much is enough, right? Do they need to go hiking somewhere beautiful, 90 minutes away, they need a car? Is laying out on the grass in the quad, right? Grass, sun, trees, is that adequate? Walking on campus, which is beautiful, like what can I encourage them to do to support their well-being?
I feel embarrassed to answer that because there's so many people in this audience that have studied that better. But I think that dose, frequency, intensity, they're really important questions. Everybody does quote the study that says that you need at least 2 hours of nature. And I don't think I have enough time now to talk about the work on how long and where you should be in nature. But from a public health perspective, the reason that I like the resiliency model is because every time I say the word nature, I can instead put the word maternal love, for example. Because maternal love also has the same impact on ACEs and health. But it doesn't really matter like how many minutes of maternal love you have. It does, people have studied like how many times you need to eat dinner together as a family, but it's really just like you should eat dinner together as a family. So One thing is maybe it's not that important, like exactly how much and exactly where, although that is not at all to say that that line of research isn't important. The other parallel that we can draw is from exercise. And what the exercise research has done is it's identified what you feel in yourself. So you need to raise your heart rate to a certain rate for 20 minutes a week. It doesn't say that you need to do a certain type of yoga, or you need to move your right leg a certain direction, or you need to do X, Y, and Z program. It has identified what it feels like to attain the correct amount of exercise. I think in nature, I think that's the direction at one point we will get to, that you'll be able to know, oh, I had my nature today. But I think that we still don't know what that is. But if some of the other people in this audience later could answer that too.
Wonderful lecture. And I have 3 points. Maybe I'm going to try to keep them to 2. One you mentioned, which I think is very important, is that nature can be in your home. I think for children, having a plant and trying to grow it, I think it gives the feeling of they are doing something, and also learning about the plant. That is a part of nature. Because I really feel that making all this prescription, and the prescription is a very good idea, but there is another, broadening it to earth prescription is a new concept coming up in some of the papers. So that you are not just going and taking things from nature. It's not a human-centric connection, but it is a two-way purpose. So you go out there, you also clean up something. So these are 2 very separate points that I got from your talk. One is give nature to everybody so they don't feel that they can't afford it. And so try to change the definition of nature by making it available for everybody. It has to be safe. It has to be easy. People don't have time to go, like somebody said, 90 minutes in a car. And coming back, you might forget everything about nature. Coming back in traffic. So it can be right available. So those are the ideas that if we can try to make them, from quantifying everything and every step. We needed it. I feel last 20 years, we needed to quantify and make it very evidence-based. But now is the time to make it more available, make it more understandable, and I'm so glad that you changed policy in your state. This is very wonderful. Thank you so much.
Just because I would love feedback on it at some point, my personal definition of nature at this point has become biodiversity and healthy ecosystems. And so our bodies are part of that. And I think, during the pandemic, we all had to think of very interesting ways of giving a nature prescription. And at that time, it included things like watch the cycles of the moon, watch the seasons, look into your child's eyes. I hope that we all have access to vast nature because there are some very special things that happen there. But I completely agree with small nature being special. So.
Yeah, I have a question. You said in one of your slides that 70% reported that they felt uncomfortable bringing up the issue between racial discrimination and nature. Could you just kind of explain that a little bit and what that issue kind of entails?
Absolutely. We didn't ask, so this question was asked of healthcare providers. First we asked them, do you understand the barriers that your patients may face in going outdoors? And a lot of them said yes. And then we asked some more detailed questions. They included things like, are you aware of your patients' cultural connections to the land that they live? Or do you know of local parks? But not every provider works where they live, so some people didn't even know what was available where they lived. And then there was a question asking specifically, like, how comfortable are you talking about racial discrimination that your patients may face outdoors? And the work of some really important researchers, including Nina Roberts, who passed recently, has really shown that the experience for non-dominant populations in the United States, that is populations of color, in public spaces is often fraught with the discrimination that they face. And so nature is not always a place of safety. And safety is an insufficient but necessary precursor to healing in nature. So if you don't feel safe, you're not going to get all of that homeostasis type stuff. Because, as we know, there have been instances where a Black child could be shot for being in a park. And so that has some real biological implications for other members of that community. Does that answer the question? Yeah. But it just means we have to fight for safe spaces. And I hope that my work, I always really try to emphasize that wanting to be in nature is not a white thing. And that really, in the United States, we have this concept of people of color being the minority, but that's really the global majority. And there's no way that the global majority is on Earth without loving nature. So the barriers to people of color being in nature have more to do with the United States and our culture than anything innate. Sorry, I just had to say that.
Hey, I'm not an academic. My background is working in the garden store, something waiting before the customers, who knows.
Talking to the
I
mic.
hear you. Now you can? Yes. Starting over, I'm not an academic. My background is horticulture, working in a garden store. Some of you look like former customers.
That means you are an academic.
You end up,
You're a nature provider.
definitely a nature provider.
Yes.
And so it's not so much a question for you, but it's a throwdown to y'all here, because this particular city has amazing resources. For instance, there's the Arboretum Specialist, no, Audubon, but we've changed that name, specialist at Seward Park that gives lectures and tours for new immigrant folk. And the assumption was, oh yeah, you get to see nature like you used to have. Well, the grandparents used to have nature. But the kids that are coming in, they grew up like cheek to jowl and somewhere to see. Not weird. What as best as could. Then there's Greenland. Then there's Woodland Park that has all kinds of programs. Then there's the folk that are trying to do something in the Duwamish area and make sure that there's parks in the South End, which there are a paucity of, etc., etc. So my question for you all is there a possibility of creating a website or a something that ties these, weaves them together? I had a walk with a neighbor, she's 88 something, and so she goes to Interlochen, and she goes with, what is it? The Mountaineers. So that's another source, and that's the question. How can you all create something so somebody can? And now I'm done.
No, I think that's amazing. There's so much happening here, and I would love if anyone is allowed to answer it. But I do want to say that in California, we heard that similar thing from healthcare providers, that they, just like maybe outdoor providers don't have patience to hear about the difference between a hospital and a clinic, and that we are all different agencies with very different rules. Healthcare providers don't often care which agency is running a different public land, and they just want to say go to nature. And we did have a 9 Bay Area-wide thing called Healthy Parks, Healthy People, where all the parks came together, and it was really beautiful across their institutional issues or things, and they agreed to be just called Park, and to have Healthy Park, Healthy People Days, where they all had the same logo, same sticker, same time of day, once a month, where any healthcare provider could write the script, and the patient would just look for that insignia. It didn't matter which agency was running that space. But I do know there's so much already happening in the state, so do you guys want to answer? Okay, after. You should talk to them.
Hi, thank you so much for your talk. I was thinking so much about how you can use this for applications on these barriers that you're talking about. Because I sit on the council for the citywide environmental education through the city of Seattle, and I don't know if you know, but the mayor just proposed a budget that will cut a lot of environmental education that's free for people in housing authorities, and connecting people, low-income people and immigrants to the parks that the person before me mentioned. And so I think a lot about that, and how can we use this type of information to reduce those barriers and create these types of changes to push back on something like this type of budget cut, or how have you used this information, if you have, for that?
And I think it's a little bit hard because we are all, hopefully not competing, but we're all looking for state budgets. In California, there is now a coalition for school-based environmental education being formed. And it's a beautiful thing where many different agencies are coming together to advocate not only for schoolyard greening, but also for outdoor ed trips and things to happen in school. And I'm trying to help them tailor that towards getting public health funding. But it is true that at the end of the day, that's going to have to come from some other suicide prevention or something. So is your question on how to be strategic about making sure that nature gets money? Because I'm with you there. If you want to do that, I would read it's sad that we can't just say love nature. I just read what they are funding, what they are doing, and what they care about. And since nature does everything, you can tailor nature to that. For me, it was resiliency and ACEs. But it might be something different here.
Yeah.
Or you could think, why did ACEs get so much funding? The reason ACEs got so much funding is because the evidence is unimpeachable. The evidence is so strong. It's like that you cannot dent it. And so if someone is going to go to legislators and say, we want $63 million for this thing, the evidence has to be at that level. Or someone powerful has to care, and none of this matters. But for those of us who have to deal with evidence.
Thank you.
Thank you.
Grateful for you to share your expertise with us tonight. It was obviously an inspiring talk, generating a lot of interest, but I know we're over time, so I want to be respectful of all your time. It's clear your leadership has driven forward real innovations and at the intersection of nature and health in ways that are already making a real impact on people's lives. I know I will be continuing to reflect on what we've heard here tonight as we at the college consider our own work in the area. I will say, at events like this, I always want to remind people of our wonderful Arboretum, which in fact sits within the College of the Environment at the moment, which is my own personal nature prescription. I try to get there every weekend. Now, as we know, events like this rely on commitment from our community, and I want to thank, in particular, our founding sponsor, REI, Cooperative Action Fund. Thank you also to the Washington Trails Association, which I use when I want to go further afield, and the Wilderness Society. we are really, truly grateful for your partnership. And thank you to all of you for joining the college for this important and inspirational evening. If you want to stay up to date about what's happening at the UW College of the Environment, please visit our website and social media channels, and consider signing up for our monthly newsletter to stay abreast of future events. And lastly, I would again like to extend my gratitude to Maggie Walker. We're so grateful for you. College of the Environment and all you do for the environment and for being such tireless champions of this important work. So with that, thank you all. Have a wonderful evening and good night.